So we will now transition into the next phase, which will first start off with the mental health check-in chat presented by Sarah Frazell from the Primary Care Coalition. She is the Director of Behavioral Health Programs there. As I indicated previously, a lot of the ideas for this meeting were generated and provided by you all. We did a survey a couple months ago asking whether we should have a meeting and what would be the topics. And the leading topics that came up were dealing with a mental health break for us public health folks, as well as health equity. And those, we just chose the top two. And there's still other topics that we look to hope in the future, but we wanted to address these two as they were the leading topics. And I personally know Sarah, as we were both in the leadership program here in the DC metro area, Leadership Montgomery, this past year. And I did attend her session on doing this kind of session earlier. And I thought that it would carry well over today. So I'm glad she was able to participate. And Sarah, the floor is yours.
All right, thank you. And I will share my screen here. All right. All right. Well, thank you so much for the intro. And thanks so much for inviting me today. As Maurice was saying, I also like the idea of the part of semi-formal. Hopefully this can be very conversational. Would love to have it be interactive. I would love to see people utilizing the chat. We do have time at the end of the presentation for Q&As, but please feel free to use the chat as we talk about different topics within this. And if you did want to take yourself off mute, you can use the raise hand feature if you had something you would like to add. And kids, pets, welcome. My cat very well may make an appearance at some point because she keeps sticking her head in the door. So yeah, hopefully this can be an enjoyable and interactive time. So like Maurice said, my name is Sarah Friselle. I am a clinical social worker and I work at Primary Care Coalition. We are a mid-sized nonprofit in Montgomery County, Maryland in the DC area. And we really focus on working with community members, hospitals, clinics, other systems in promoting health and well-being, especially for those who may be experiencing vulnerability due to income, immigration status, racism. My role there is I'm the Director of Behavioral Health Programs, and my main job is that I oversee a collaborative care model of behavioral health where we provide behavioral health care within safety net primary care clinics. I'm also the co-chair of the Social Workers Unraveling Racism Committee with the National Association of Social Workers Maryland chapter. So I'm so happy to be here today focusing on this topic, and also health equity is very important to me as well. So just running through what we will be talking about today. So we will be talking about kind of the impact of COVID-19 on the field of public health and public health workers and students. I hope that you'll come away with a lot of tools and resources that you can use, and slides will be shared later. So I've tried to incorporate things that you can do a deeper dive on later. We will be doing an interactive guided meditation session. And then, as I mentioned, we will have some time at the end to go over questions and answers or any dialogue. So I don't want to focus too much on kind of the depressing statistics, but I do want to talk a little bit about some of the impact of COVID-19 on public health workers. So a survey just came out, I think it was about a month ago, of about 26,000 public health workers, and found that 53% reported symptoms of at least one mental health condition in the prior 2 weeks. So depression was the number one, followed by anxiety, post-traumatic stress disorder, and even a pretty high amount of suicidal ideation. And the people who were most impacted were people 29 and under, non-binary or transgender individuals of any age, and people who were working really long hours and or had an inability to take off of work. And I think that probably isn't shocking to many of us here. I mean, we saw kind of the impact of not only people who are working in hospitals and clinics during COVID, but anybody working to help other people, because we weren't able to do kind of what we were trained to do in a lot of ways because of limitations. And that definitely had an impact on us. For students, I think there are some students here today. So I don't think these statistics will probably be a surprise to you. But in another survey, over 95% of students reported having mental health impacts from COVID-19. Students reported less exercise, sleeping less, feeling hopeless, socially isolated, having death of loved ones due to COVID or other issues, having a lack of kind of the campus activities or maybe the typical kind of high school or college experience, not having the ritual of things like prom, graduation, and trouble focusing on the online learning platforms. So I think we all know what may cause stress in our lives. And I want to also add that, you know, all of the things that maybe were kind of unique to this year doesn't mean other stressors went away. So you know, we were living through this pandemic. We had a very stressful election. We had a big civil rights reckoning that brought a lot of good things, but was also, you know, brought a lot of stress and change. But in addition to that, you know, life went on too. We had people had other health issues. There's natural disasters. There's people just having regular old family or work stress. But I think uniquely to having kind of the health concerns for yourself or for loved ones, financial changes, maybe, you know, having less hours at work or getting laid off, having a change to routine or work schedule. I think in some ways there's this kind of two extremes. There was a lot of people who were working more hours in person, like in hospitals and clinics. And then a lot of us, myself included, who transitioned to work from home when I had never really done that before. I remember those first couple of weeks in March 2020, just working really weird hours, like not having kind of boundaries between work and home life. Having this sense of the unknown, which, you know, kind of continues now, that hasn't gone away. Constant barrage of media. So maybe getting text alerts or checking the news first thing in the morning. Or maybe someone in your life will text you, oh my gosh, did you see this newest statistic? I think all of us, you know, are in this type of field because we care about people, and often we care about communities that are vulnerable. And in a lot of ways, that's who is hit hardest. And so we take that on, we feel that. And then I think one of the other big hard parts is the things that we usually turn to. Maybe it's religious services, maybe it's going to the gym, going out to the bar or restaurants with friends. A lot of that kind of disappeared or was not accessible. And while some of that is coming back, it may kind of look different. So I would encourage you in the chat too, if you have other things you can think of that were kind of a big stressor in this time that we may have missed. I want to also introduce the topic of moral injury. Oh, hugs. Yeah, I totally agree. Yeah, the physical touch piece, even like high fives, handshakes. Yeah, it has felt weird. Yep, going to the theater, 100%. Yep, I have missed that as well. So moral injury, I referenced this a little bit earlier, but I think that that's something a lot of us have experienced as well. So originally this term was used for soldiers in combat. And basically what it's describing is not being able to kind of do what you were trained to do, or having to do things that are against your moral code. And this can lead to shame, burnout, and kind of impact your inner moral compass and your sense of right and wrong. So I think some of the examples we've seen is we've heard from kind of the frontline healthcare workers, you know, there was often not enough beds or not enough ventilators, kind of triaging who could get what care. Some of us maybe who are working more on the policy end, it might have looked different, but I think we experienced some of that as well, like creating policies or trying to come up with solutions, knowing it wasn't going to fix all the problems, and we wouldn't be able to help everybody that we needed. Yeah, I'm seeing a lot of good chats in here. Yep. Yeah, I think that all of that has definitely taken a toll. And I think with moral injury, one of the difficult things is, I think probably most of us here are helping people. You know, we're helpers, we're fixers, But really to kind of fix this issue, it takes a whole systems approach to fix. And a lot of times we tend to probably feel overly responsible as individuals, and that can take a toll as well. So again, I would encourage people to share in the chat to any symptoms of stress that you notice physically. I think some of the big ones are aches and pains. Part of that, I think, comes from working from home. At least for me, I didn't have a good ergonomic setup. So the stress plus like the first couple of weeks, like sitting on my bed, like hunched over, not so good. GI problems. So maybe changes in appetite, indigestion, headaches, sleep irregularities, lowered libido, as well as lack of interest in other things as well. Compromised immune system. Feeling cloudy, kind of that brain fog, trouble making decisions, trouble taking deep breaths. I think I've experienced that as well. Trouble. COVID, weight gain. I think a lot of people have experienced that just kind of due to changes in habits, the stress. Emotionally, so I mentioned depression, irritability. I've definitely noticed that one in myself, having kind of a lower threshold for annoyances or frustrations, whether at work or with, family. Feeling sad, feeling angry, sense of fear. And that's, pretty natural. Like we've been living in scary times, and it makes sense that we would feel fear, but having that kind of chronic fear can definitely take a toll. Feelings of helplessness. Grief, definitely. Grief for people we've lost, grief kind of in general about all of the loss, as well as, like I mentioned, the loss of things like ceremonies, funerals, weddings, proms, celebrations, birthday parties. So cognitive, imposter syndrome. So I don't know if others are familiar with that term. And I think it's something many people had before, kind of that feeling like, oh my gosh, like who am I to be in this position or this role? I'm not qualified. I'm here by accident. But I remember thinking a lot during the pandemic, like, I'm not prepared to lead a team during a pandemic. I don't know how to do that. Like someone else would do a better job, before realizing, well, none of us probably really were trained to do that, right? But kind of living through this stress can increase those feelings. Trouble focusing. I saw several people mention that in the chat. Unable to grieve normally. Exactly, because due to sometimes loss of ritual, or sometimes it's just that there's so much going on, you're kind of in survival mode and there hasn't been sort of a time to grieve. Intrusive thoughts of trauma or catastrophe. So I would be interested to know if anyone else had this experience. If you were watching like a TV show or a movie that took place in the before times and people were hugging or in a crowded place, did anyone else have that reaction? You're like, oh my gosh, they're all going to get COVID. And this is, So that's our brains, right? We're in that trauma, we're in that survival mode. And I think it's still going to take me a while, even years down the road, to sort of get out of that. Trouble balancing work, school, or personal life. So maybe we're overworking, we're underworking, or we're working more hours, but it's kind of a lot of time just like sitting, not really able to get anything done. Feeling low self-esteem. And dread related to certain tasks or types of patients if you're working in direct care. So like, oh my gosh, I have to do this report, and just like even worse, procrastination than usual. Or if you're working directly with people, maybe it's like, oh my gosh, this is another person who's lost someone from COVID. I don't have the emotional capacity to help. Having it hard to see any positives in your work. So that was a lot. I said, I kind of starting on the downside. And I think, again, a lot of this is not new to any of us, but I did want to review that quickly, because I also find it comforting to know that none of us are in that alone. Like, and seeing in the chat, there's a lot of shared experience here. So wanted to kind of, pause and see if there's anything else people wanted to add. I'm going to just catch up on the chat a little bit here. Okay, I'm glad to hear. Yeah, that's validating. Yeah, HGTV, I agree. I've been watching more HGTV, more Food Network. Yeah, more violent content, difficult. Yeah, people in crowds. Yeah, yep. Yeah, trouble doing a job as once did, loss of capacity or resilience. And yeah, and I think it's important to remember that we are all human too, right? And this is new for all of us. And so it makes sense that we feel like our reserves are kind of tapped out. And yeah, working in COVID response, yeah, getting the news all the time. A lot of people have been in positions where you can't really tune out. I was reading a interview with Dr. Fauci once, like going over his schedule for the day. And I'm like, man, it was just like meeting after meeting and stats and stats. And it's like, how does somebody in that role, like, how do they manage that? Yeah. People who died and couldn't have a funeral. Mm-hmm. Yeah. Yeah. That was very common experience. Yeah, not knowing what the next phase was going to be. And I think we're still going through that, right? With kind of the Delta variant changes to policies. I think we're kind of continuing. And I was just reading this morning about how some healthcare workers are starting to feel some PTSD again around the increasing numbers and kind of this sense of dread. Yeah. Yeah, anxiety about it coming back. Totally. I definitely relate to that. So all that being said, I did want to share some things that may be helpful and that will kind of help us in this, in what we're going through right now. So I wanted to talk about self-care. And I feel like it's become a very buzzy word. Sometimes like, oh, it's just easy. You just do more self-care. And I don't know if anyone has had this experience too, not in my current job, but in a past job that I had that was extremely stressful and not much support. One of the messages we had gotten from management was, we'll just do self-care. And there was not kind of the support to do it. So I don't say it as it's kind of a Band-Aid solution. And I also think, sometimes people are like, oh, self-care, it's like getting a massage or having a glass of wine. Like, sure, sometimes it is those things, but there are other things you can do as well that might be a little harder, a little more complicated, looking a little different. So hopefully you can find some of this that will be useful for you. And I would love the chat to continue of people sharing what they're doing for self-care as well. I'm already learning a lot from the comments you're sharing. So I look at self-care as any activity that we do deliberately to take care of our mental, emotional, and physical health. So that is a definition from Rafaela Michael. So I've seen a lot of conversation here around media and the news. And I agree that that has been and continues to be a big stressor. So a few suggestions around that is, I think it's been really helpful for me. I heard this piece of advice to set specific times in your schedule when you'll check the news. I need to get back into that habit. I already this morning was guilty of checking before I even got out of bed. So I think setting a specific time, I would not recommend doing it first thing in the morning or right before you go to bed. But maybe, right, you've had a cup of coffee, you've had breakfast, you're logging into your email, maybe do it for 10 or 15 minutes and from a reputable source, whatever that means to you. But I would avoid anything that's going to be very like heavy on the video, audio, maybe kind of clickbaity headlines. Just like reading can be much better. Setting an action item step after you read the news, so you don't feel quite as helpless. So maybe that's you donate money to your favorite small business or cause, you call your representative, or just taking deep breaths, but thinking about something specifically that you plan to do. Avoid scrolling or doom scrolling, if you've heard that term, where you just kind of like click and read on more and more disturbing things. What helps me with that is I put, and I'm trying to remember how to do it on iPhones. I think it's in settings. It will give me an alert when I've spent, I think it's over an hour on social media a day. And if I really want to read something, I can like circumvent it, but it is a good reminder, like, okay, I should probably do something else. I mentioned avoiding videos because you're getting that extra sensory input. Sometimes it's of really upsetting images or sounds. So I would say reading or listening to the radio, because then you're only getting one type of input versus multiple. And again, definitely not checking news right before you go to bed or when you wake up. I'm going to just catch up on the chat here a moment. Oh, a self-care women-focused podcast. Awesome. Yeah, I'll have to check that out too. Very cool. Yeah. Okay. So sharing responsibility. So we are obviously dealing with a lot of big challenges, and none of us are going to be able to solve that on our own. And no one profession is going to be able to solve it on our own. It requires a bunch of different people, different systems working together. Again, I think, like I mentioned, I think a lot of us are fixers. We're very solution oriented. We're helpers. And at least one thing I've noticed in working kind of in the community mental health and nonprofit world is there are a lot of well-meaning people who tend to kind of get a martyr mentality or feel like they have to be Superman, Superwoman. I even think I have a social work background, and I think that there's sometimes an unhealthy narrative that we put on our superhuman cape. I think the narrative is starting to change around that a little, but it is very necessary, and it's okay to ask for help. Not one of us is going to be able to do it all. And again, I'm constantly reminding myself that this is new. None of us have lived through COVID-19. None of us have lived through now a Delta variant. None of us have been through having the election of 2020. And it's a marathon and not a sprint. So we need to figure out, times when you may need to kind of take a step back from helping and let other people who have the energy do it so that you can come forward more refreshed. And just keep an eye out for any kind of self-talk that might lead you to burnout. So if you notice you start thinking, oh, it'll be selfish to take a break, I can't take my lunch, or my needs are not important, other people's needs are the only important ones. I think that should have a buzzer go off in your brain. You start noticing that, or maybe tell your family members or coworkers, okay, that might mean that you need to pause. Yeah, ultra marathon. Yeah, that is a great metaphor for what it feels like right now, for sure. Yeah. So taking care of our bodies. So I think, the things we all know to do, washing our hands, following CDC recommendations, which I'm thinking about too with the mask guidance too, that can be another source of kind of fatigue though, right? Trying to keep on top of what's the right thing to do. This was one I specifically was thinking about for students, but I think is good for everybody. Considering a routine for when you wake up and when you go to bed. I know myself and a lot of my coworkers, those first few weeks of COVID, I was getting emails at very odd times of day, sending them very odd times of day. I'd have a couple hours in the middle of the day where I felt like I was just checking the news or couldn't function. And then I would work late into the night. That was not very sustainable. So I think trying as much as possible to have a regular routine. Having things prepared, right? So medications, prescriptions, healthy foods, eating a balanced diet. So I think everything in moderation, right? Comfort foods are important. Cheez-Its, Cheetos are probably mine, but also noticing how you feel afterwards. So trying to also get some protein, fruits, vegetables as well. Drinking a lot of water. I think the other nice thing about that is they'll force you to kind of stand up if you have to use the restroom a lot. We mentioned we're probably all sitting more than usual. So hydrating is really important. Taking stretch breaks throughout the day, also important. And exercise. So I know that some gyms are kind of open again. There are some classes, people's comfort level may vary, but doing some YouTube workouts if that's easier, going for walks. I'm looking forward to when the weather cools down a little bit to be able to run outside again. Let me just check on the chat here. Yeah, the social. Yeah, that's a good question about the iPhone feature. Yes, I think that it does do it concurrently. it's like the whole, yeah. I think it's like over the course of the whole day, not all at once. And emotional health. So feeling your feelings. I think we have been in survival mode for a very long time of just trying to get through and maybe kind of suppressed some of the difficult emotions, but taking time that it's okay to cry. It's okay to like stomp your feet. It's okay to feel joy too, because there are also good things happening as well. But just noticing them and know that it's okay and it's normal and human to have feelings. Seeing a therapist, and I know that I guess one of the nice things to come out of all this perhaps is the expansion of telehealth. So there are a lot more therapists who are doing that now, if that's more convenient or more comfortable. Virtually engaging with religious communities. Again, I know a lot are doing in-person services again, but some are continuing to do a lot on Zoom or other things as well. Oh, cry dates. That is a great idea. I like that. Watch a sad movie. Any recommendations? I like My Girl for a good crying movie, but I would love to hear other suggestions. Yeah, I like that, to kind of that catharsis of crying it out. Cooking, I've found that very therapeutic. I know early pandemic, a lot of people were making sourdough bread was a popular one, but yeah, trying a new recipe. Reading a book, listening to a podcast. I found it difficult to read books kind of at the beginning just because the attention span wasn't there. But whatever, even if it's not inspirational, even if it's kind of fluff or whatever, it gets your brain kind of out of the current moment. Yeah, these are a lot of great ideas. Finding a mantra that might work for you, like I will focus on day to day, or this is a new situation. I will do the best I can today. Yeah, paint by number. I did that as well. And I also just started diamond art, where you glue like the little diamonds. It's similar to paint by number. Yeah, meal kits. Yep. And I think this last one, the making a mental note, or even better to like physically write it down, maybe on your phone or on a piece of paper, positive things that you see happening. So it could be simple. It could be that, you saw your kids being nice to each other, or maybe you saw an uplifting news story. But what that does is it trains your brain to start looking at that as well as some of the difficult and negative things that are happening. And meditating. So that will take us in a moment to doing some practice in that. But self-care at work and at school. So having healthy and supportive relationships with your colleagues, classmates, and supervisors is really important. I know on our team, we've been doing a lot of chats on Microsoft Teams. Like sometimes we'll share like funny memes, pictures to try to stay connected. Looking at how people's routines have changed. So being patient with yourselves and others and kind of adjusting to that. Writing out a schedule and a couple goals at the beginning of each day. And they don't have to be huge. Maybe it's, okay, I'm going to get half of this report done for work, and I'm going to call my friends this evening. And including in that schedule or that to-do list breaks for movement and food. Scheduling check-ins with team members and supervisors. Maybe it's like a coffee date, or as some people are going back into the office and you're going to be there the same time, like, hey, let's just have a quick chat on when we're both there on Tuesdays. And engaging in rituals and routines to separate the boundary between work and free time. Maybe it's changing clothes. For people who have commutes, again, that's kind of a natural one. But even if you're still working from home, you could like close your computer, go walk around the block. One thing that I've found helpful is I have a little ottoman that's like a storage cube. So I physically put all of my papers and my computer in it at the end of the day. And then I stopped checking email on my phone. I deleted the Outlook app. So I would have to like physically go in and log in to make it harder. Finding time to work on long-term passion projects. So maybe you've been kind of in crisis mode, putting out fires, but is there something kind of long-term or unrelated to COVID you'd be interested to work on? And again, I mentioned that probably a lot of us have had that experience where we don't maybe feel like we get the support from management or from organizations on self-care. And so this is my plug. If you are in leadership, consider ways to make policies and culture conducive to that and practice what you preach. I think that's huge. If you want staff to disconnect, don't, maybe if you are working late, and I'd say, maybe try not to if you are able to not. But if you're working late and have an email, maybe have it send at 8 in the morning, 9 in the morning instead, so that way staff will see, okay, this is important to be able to unplug. If you are taking leave, try to really delegate to other people so you can actually unplug. Because if you're supervising people, you're supervising a team, they're going to watch that. And that's very important. And I just wanted to include this funny tweet from March 16th, that I know that this has all been very stressful for everyone, and in particular kind of stressful for parents who were working at home, having kids doing virtual school. So I enjoyed that one. All right, so before we get to mindfulness, let me just catch up on the chats here. Yeah, brain healthy foods. That's a good question. That's not super my area of expertise, but if anybody has any suggestions on that, I mean, I know whole grains and fruits and vegetables are always good. All right, so mindfulness, that can be really helpful in helping us get through this. I can't remember who said it, but this ultra marathon that we're on, right? And for the rest of our lives, it's an important skill to learn. So really what mindfulness is just being aware of your body, mind, and feelings in the present moment, and it can help with feelings of calm. So there's a lot of benefits. It can regulate and express emotions. It can help you utilize better coping skills, be more attentive and less easily distracted. It can really help with sleep. And there are also a lot of studies that show it can help with things like high blood pressure or other health conditions. So I want to share a few very simple mindfulness exercises that you can kind of sprinkle throughout your day. I mentioned that I am a clinical social worker, and so all of these are things that I teach clients as well, who are dealing with maybe trauma or stress, anxiety. I think one of the easiest ones you can do is notice your feet on the ground. So we can try it right now, whether you're sitting, standing, just notice your feet on the ground. And it only takes about a second, but it can remind you of your presence and kind of where you are. I really like this next one. So in the morning, visualizing a peaceful color or shield around you before you start your daily routine. I particularly find this helpful if I know I'm going to have like a meeting or an interaction, either at work or personal life, that may be stressful. It's kind of imagining that peace around you, like a peaceful type of energy. I like to imagine like deep, dark purple is a peaceful color for me. Again, if you are having a difficult conversation or you're finding you're getting really agitated, having like a ring, a small stone in your pocket, that can also help you with mindfulness to kind of bring you back to where you are. And paying attention to the tastes, smells, sensations of what you're eating versus, and I know we're all probably guilty of this sometimes, just like a quick sandwich or salad while we're checking email. Eating is a really good natural time to try to practice mindfulness. So please feel free if anybody has any other mindfulness things that they do to share. Yeah, the totem and inception. Yeah, exactly. So meditation is one way you can really practice mindfulness. I think a lot of people feel a little bit intimidated by meditation. I know when I started, I'm like, my brain is too busy. I can't get it to quiet down. But I think starting with very brief times of meditation can help. And it's kind of like learning how to flex your muscle. It does get easier. Yeah, I saw someone mention Spotify. Yeah, they do have some good meditation lists. So basically what it is focusing the mind on a particular object, thought, or activity. So it doesn't have to be that you're just sitting silently. for 10 minutes. I personally find that very hard. I like to have something to focus on. So it's, been practiced in cultures all over the world for thousands of years, practiced in many different religions. It sometimes is used for religious purposes, but it's not always connected to that. And you may have to experiment a little bit. Like I said, there are some people who can just sit in silence 10 minutes. That's not so much for me. I like a more guided meditation. So, even if one kind doesn't work for you, you might find another one. So now is maybe what we've all been waiting for. I'm going to guide you in a couple different meditation exercises. So what I want you to do, if you're comfortable, is to, and if you prefer to take your camera off, if it's on, that's great, but to go ahead and close your eyes. And I'm going to guide you in a progressive muscle relaxation. So we will be tensing and then relaxing muscles. I would add the disclaimer that for some people, if you have pain or issues in a particular part of your body, you may want to skip the tensing part and just focus on the relaxation. So go ahead and find a comfortable seat, uncross your legs if they're crossed, feet on the ground, and start by putting your hand on your stomach. And then you're going to inhale deeply and feel your stomach expand. Hold it a few moments. And release. And then we'll do it once more. Inhale. And then exhale. Now we're going to start by focusing on our left foot. So I want you to tense your foot, maybe curl your toes up, scrunch it, pull your toes towards your face, hold it, and then let go, feeling the sense of relaxation. Now tense your left calf muscle. Scrunch the muscles, feel the tension, and then relax. Now we'll scrunch and tense our thighs, feeling that sense of tension, noticing what that feels like. And now release and relax. Now we'll try our right side. Tense your right foot and toes, stretching your toes towards the ceiling. Notice what it feels like to hold that tension. And now let go and relax. Now scrunch up your right calf, feeling that sense of tension. Hold it and release. Now your right thigh. Tense up the muscles. Notice what it feels like. And then relax. Now we're going to tense our stomach and chest. Clench your stomach. Tighten your chest. Like you're sucking in your abs. Hold it. Feel that tension. And then release. Now we're going to focus on our left arm. So start by making a tight fist with your left hand. Scrunch it. Feel the tension. And then release. Now scrunch your left shoulder up towards your ear, like you're shrugging your shoulder. Notice the tension. Hold it. And release. Now we'll move to the right arm. So make a fist with your right hand. Hold it tightly. Notice the tension and release. Now scrunch your right shoulder up towards your ear like you're shrugging. Hold the tension. Notice what it feels like. And release. Finally, we'll focus on our face. So I want you to scrunch your face as tightly as you can. So you may be scrunching your jaw, wrinkling your forehead and nose, feeling the tension. Hold it. Hold it. And release. Now we're going to finish with a couple deep breaths. So place your hand on your stomach again and inhale deeply. And exhale. Inhale. And exhale. And as you feel ready, start wiggling your fingers and toes and open your eyes. And I'd love to hear in the chat how anybody is feeling or any questions around that exercise, or if anybody has done progressive muscle relaxation before. And I'll add to, if this is something you want to do at home, there are tons of YouTube exercises. I think, yeah, it's at Spotify. So again, it's important to play around with it a little bit, in the sense of, you may find that one of the recordings you listen to, the voice is irritating to you. You can try, you can try another one. I'm almost passed out. Okay, I would take that as a maybe good sign that it was helping with relaxation. Yes, or a sign of sleep deprivation. Yeah, fun. Yeah, Full Catastrophe Living. Yeah, that is a good book. Also for learning more about mindfulness. Yeah, the tension in the back. I noticed that a lot too, because when I was scrunching my shoulders, and like, this is what I feel like a lot of the time. And then to purposely relax felt much, much better. So it may be that, you know, putting on your schedule or a little reminder in your Outlook or Gmail, like, okay, at 2 p.m. today, I'm going to take a break and do progressive muscle relaxation, or before bed. It can be really good for helping you fall asleep. So the second exercise that I want to teach is called 5-4-3-2-1 grounding technique. And this is another one that I teach clients a lot to use as well, especially if you're in a distressing situation or about to be in a distressing situation. So you can just kind of practice this on your own where you are right now. But basically what you'll do is, so we'll start with looking. So we'll look for 5 things that you can see and say them out loud. So my example is, I can see a closet, a light switch, a yoga mat, my computer, my shoes. Is that 5 or 4? I'll do one more just in case. And my diamond dot art is on the floor. The second one is, you're going to notice 4 things that you can feel in your body. So I noticed that my hands feel hot. It's kind of hot in the room. I can feel the soft fabric of my skirt. I can feel the squishy rug under the floor. And if I touch the mouse, I can feel that that's a little bit cooler. The next is to count 3 things that you can hear and say them out loud. So I can hear my husband's computer in the other room. We're both working from home. I can hear my cat's like bubbly water fountain. And I can also hear my neighbors upstairs walking. I'm in an apartment building. So, and then 2 things you can smell. So sometimes this one might be a little bit more difficult depending where you are. Usually you can find 2, but if not, you can also think about something that you like the smell of. But I lit a lavender candle before I started this session because it helps me stay chill. So that's definitely one thing I can smell. And then I can also smell a little bit the yoga mat smell because that is also in here. And then one thing you can taste, again, maybe you're not eating or drinking anything at the moment. So I'll think of one thing that I like to taste is lemon in my water. That's something that also helps me drink more water. So this is also a good, fairly quick thing you can do if you find you're really stuck or ruminating or kind of panicking, because it's forcing your brain to focus on a different activity. All right. Yeah, I like getting a buddy and scheduling a time. Yeah, exactly. I think that's a great idea. Some accountability. So I've shared several resources, and again, you'll be getting these slides, but these are some books, websites, apps that I really recommend. Trauma Stewardship is a wonderful book that said if you're in any type of career or volunteer position where you are helping others, whether that's like broadly with policy or research or kind of working like as a healthcare provider, there's a lot of really good tips. And it was a very, very validating book. I think it's fantastic. So highly recommend it. Charlene Richards, I've learned a lot of what I know about this topic from her. She has a website called Caring Safely. I'll also put in a plug. I have this on a slide later, but she is also doing some free trainings for Primary Care Coalition for those who are in kind of the general DC, Maryland, Virginia region. So I'll have a link to that, but she's doing a couple of trainings for us, free virtual in August. But even if you're not in that area or can't make it, she has a lot of great information on her website. These are a few other websites that I enjoy if you want some like guided meditation scripts. The Stop, Breathe, Think app and website is great. And they have some COVID specific meditations, which I've found personally very helpful. I also wanted to include some resources if you do feel like you are looking for more assistance or feel like you need more help with your mental health. I think that's obviously a huge issue for so many people right now. And I know sometimes there can be stigma around that, but as we've seen from those statistics, I think that people across, all different sectors, all different socioeconomic class, a lot of us are experiencing mental health concerns or issues. So I have the National Suicide Prevention Hotline. I've included, and I think there's some people from other states here too. But I do have on here DC, Maryland, Virginia. Most states do have some type of like a general hotline as well that if you want resources, you can call, they can connect you. Psychologytoday.com, you can look for therapists there. And I mentioned the training. So that's specifically compassion fatigue for healthcare workers. We also have a couple trainings, again, free virtual for mental health first aid. And the link to that is on that slide. And now I just would like to open it up for any questions, any thoughts. So feel free in the chat, or if anybody wants to come off of mute, now is your chance if you want to just use the raise your hand feature. Yeah, great point. If in school, check to see if they have resources. Yeah, often that can be a good, good place to start. Yeah, physical therapy. Mm-hmm. Yeah, don't have time. I think that's probably number one, why a lot of us are not incorporating self-care, or it almost feels like it's just another thing on the to-do list. Like, oh no, I got to add that. So I think the key is like finding what do you enjoy doing as well. Lifeology and LifeWorks, affordable mental health services. I was not familiar with that one, but yeah. And the resource slides, I will go back to that one. I saw somebody who was looking. So I think all of the slides will be sent later during the week, but I don't know if you want to take a screenshot or anything specifically of this one. I will leave that up. Now, these are some great mental health resource. Yeah, openpathwaycollective.org. Okay, great. Yeah, I'm adding these to my list of resources as well. Great. All right. Well, I will wrap up then, and included in the slide that will be sent out. I also is my contact information, and then as well, if you want to learn any more about Primary Care Coalition. So thank you so much. This is a great interactive session. Like I said, I learned a lot from everybody's comments in the chat as well. So thanks so much.
Thank you, Sarah. That was very informative and relaxing. So thank you.